out at Verizon. A lot of stuff going on over there in your healthcare and life sciences. Give us a top line.
Yeah, no, I was smiling listening to Dr. Osborne because many of the things that he had talked about are things that we're very hyper focused on as well. And I talk a lot to my team. So I lead the innovation team, if you will, for healthcare and life sciences. And I talk to them a lot about um, we need to help our provider customers with operational efficiencies. I mean, we love talking about all the stuff that's happening, with computer vision in the surgical room, right? Augmented reality, physician puts on a pair of HoloLens. We can overlay three-dimensional image. The physician can see the tumor, guide his or her incision. AI-enabled gloves. When my boys tell me, Dad, what you do for a living sounds boring. You work in technology. I go Tony Stark on them. AI-enabled gloves, digital twins of spines, rotating. So it's some really exciting stuff. But before we really get there and focus on all these amazing things happening from a clinical perspective, we have to help them with their operational efficiencies first. And in this role, one of the things I love about my role is having the global responsibility is I hear from all these new digital health IT companies. I think there was one study or one publication I read where there were 13,000 new digital health IT companies that came to fruition as a result of COVID. So I certainly hear from a lot of them. And one of them and I'll just share this one because, Dr. Osborne, again, got me thinking about this one, ambient listening and whatnot. I've always said my dream in healthcare, if you will, is to make it proactive, right? And so we're doing lots of work in the home, right? There's this decentralization of healthcare thing going on, more care moving into the home. So, my team is really focused on, how can we help deliver a better patient experience in the home with us as the enabler, right? And there's a specific company that has this AI-based voice companion. And so not only is, think of an Alexa type device that's ingesting all this sensor data, but it's also learning the behaviors, of that patient. Maybe there's some computer vision in this individual's home. They're complex, they're chronic. Watching their activity, their gait. Hey, they've got to change in the way they're walking. They might be at a fall risk. But it's learning the behaviors and it's interacting. That's the one piece I hadn't really seen. And it's interacting. Hey, how you feeling today? Or did you take your lisinopril? You've got an appointment at 4:00. Do you have transportation? Can I call you an Uber? Would you like to make it virtual? But just that whole proactive and predictable. So I'm really excited about, the technology that's happening, both inside and outside of the hospital. But to Dr. Osborne's point, we have to help, our providers in our communities with the operational efficiency piece, so that they can prepare for all this emerging tech. Because when I think of 13,000 new digital health IT companies, well, a lot of the hospitals in this country still have that old infrastructure. They can't take advantage of a lot of these things that are happening, where you need more bandwidth. And I promise I'm not about to do a Verizon commercial because I'm talking about more bandwidth and low latency, faster speeds. But to take advantage of this emergent tech, you need those things. And that's kind of where my team comes in.